To effectively frame and create a process behind the Crisis Response Forum, we developed 8 different priorities, and then this flywheel process really to drive the coordinated execution of these priorities. So the first priority was, how do you effectively coordinate the public health response? The second was, how do you look at housing, both for the homeless and the unsheltered population? Then soliciting and distributing PPE resources, and so building the supply chain management behind that. Next priority, public safety. How do you take care and serve the public in a very safe environment, ensure their safety? The next is supporting Boston school children. So looking at Boston public schools, we already talked at length about it's more than just education, it's part of the social infrastructure and family infrastructure inside the city, ensuring continuity of critical municipal operations. And so if there's something like 18,000 employees inside the city of Boston, or that serve the city of Boston as a governing body, all but maybe 100 of those were working remotely. So how do you ensure the continuity of operations for the city during this time? And the last 2 are, how do you support the financial health and quality of life of Boston's families and businesses? So there's an economic factor to everything that we did, and an impact that had to be considered. And then the last priority is communicating and connecting with Boston residents. It's really important and critical that as all these things are happening in service to and support of the residents of Boston, that the government is communicating frequently and clearly and transparently with the efforts that they're doing to try and help the residents in which they serve. And so in order to make all of that effective, there had to be some sort of consistent process that we were able to leverage and drive outcomes. The outside was the process in which we undertook during every crisis response forum to assess, align, and act on that new information. When you're dealing with a very complex environment that's moving really quickly, oftentimes the reality is not what we would like it to be. And so it's really important to define what the current reality is. Not what we wish it would be or hoped it to be, but no kidding, what is actually happening on the ground, and then what do we need to do with that? Once we understand what reality truly looks like versus what we wish it would look like, we have to start developing prioritized plans. The solution to a very complex environment is to create clarity through simplicity. And so after understanding what the current reality looks like and then defining it in terms that we can understand, developing prioritized plans to go do and conduct action inside the current reality, there's a need to create simple rules that cut through any ambiguity and mitigate any kind of confusion. An example of a simple rule that we would have is, if you're taking any action that impacts another department, you are obligated to pull that department into both the planning and the action. And so if I am Department of Health and Human Services and I now have a new guideline for social distancing, well, that necessarily impacts different economic sectors such as hospitality. And so you have to pull in the Department of Economic Development to understand how social distancing will impact small and large business owners in the Boston area. So very simple rule. If you're crossing boundaries, if you're doing something that impacts another department or another team, you have to pull them in for the planning and execution to make sure it's coordinated effectively. The next part is, how do you cultivate 360 degrees of communication? Oftentimes, when we're trying to get information, it goes through, and we have a large organization, it goes through multiple layers. And every time it goes through a layer, it gets modified slightly based on the perspective or the lens of that person it's going through. And every time it goes through, a different layer, different lens, it slows down the speed of information flow. And so not only is it a bit slower and it's not as accurate as the real-time information, but oftentimes there's folks in different parts of the organization, or people in different parts of the organization get excluded based on level or tenure or where they sit inside the organization. But if you truly want to understand what's happening, you need to develop 360-degree draw of that information. One example might be someone's on the ground at a vaccination site or at a testing site. Instead of going through 3 or 4 or 5 layers to understand what's happening, we invited those people to the crisis response forum so they could give a no-kidding real-time update and real-time reality check on what's happening on the ground. And that happened through every department and every cabinet and every service the city had. How do we get a good 360-degree perspective on what's going on and not have well-intentioned blinders put on everybody? And then the final component is empowered execution. Now that we've defined what reality looks like, we've developed prioritizations and plans against that. We know the simple rules inside the organization to effectively work with each other. We've got a 360-degree communication of not only what's going on the ground, but if there are any challenges, you're able to harness the thoughts and the brain power of more people in the organization than just a small leadership team. Then you're telling everybody to go out and to go do. We've talked about it, now go do for the next 23 hours. And at 08 in the morning, we're going to come back together, we're going to synchronize in the net change, and then this flywheel happens all over again. We'll understand what the new reality is tomorrow. We'll reprioritize our activities and plans. We'll confirm simple rules. We'll make sure that we're hearing voices from across the organization, and then we're going to go do together again. And this happened day in, day out, 7 days a week for the entirety of the COVID response.